Hello, everybody. Welcome to Anatomy MCQ Part 2. Anatomy MCQ in the pattern of PGI exam. These MCQ will help for Fmge, Neet PG, and upcoming next exam. Let's go with anatomy. Question number 11. External anal sphincter is innervated by A. S2, S3, S4, B. S2, S3, C. S1, S2, D. L5, S1, E. L2, L3. Correct answer is A. S2, S3 and S4. Anal sphincter. Two sphincters, internal and external, surrounding the anal canal. Internal sphincter, sphincter ani internus. Involuntary, sympathetic fibers through superior hypogastric plexus. Parasympathetic fibers from pelvic splanchnic nerve. S2, S3, S4. External sphincter, sphincter and externus, voluntary, surrounding the entire length of the anal canal. Inferior rectal nerve S2, S3, S4 and perineal branches. Question number 12. A patient had a lesion in a wrist. On examination, the thumb was laterally rotated and adducted with ape thumb deformity. Which of the following nerve is involved? A. Median, B. Ulnar, C. Radial, D. Post interosseous nerve, E. None. Correct answer is A. Median nerve involved for ape thumb deformity, also called simian thumb. Ape thumb deformity is caused by damage to a distal median nerve, so-called median claw lesion, and subsequent loss of opponent's pollicis muscle function. The thumb is adducted and laterally rotated so that the thumb lies in the same plane as the other fingers. It is due to overaction of the adductor pollicis supplied by ulnar nerve. Question number 13. Spring ligament refers to plantar calcaneoavicular ligament, short plantar ligament, long plantar ligament, both P and C, E, none. Answer is A. Plantar calcaneoavicular ligament. The spring ligament, plantar calcaneonavicular ligament, is a group of ligament which connect calcaneum to navicula. It consists of superomedial ligament, medioplantar oblique ligament, medial or intermedial calcano-navicular ligament, inferoplantar longitudinal ligament, lateral calcano-navicular ligament. Question number 14. Which of the following is not a content of the medial wall of the middle ear? Oval window, round window, processus cochleaiformis, additus and antrum, notch of Rivinus. Correct answer is D and E. Additus, antrum and notch of Rivinus. Medial or inner labyrinthic wall of the middle ear. Paris labyrinthica. It is formed by lateral wall of labyrinth. It presents following structure. Promontory. It is a bony bulge which is due to the basal coil of cochlea. Tympanic plexus present over it. Oval window, fenestra vestibuli or ovalis. Footplate of stapes. Round window, fenestra cochlea or rotunda, covered by the secondary tympanic membrane. Horizontal tympanic part of the fallopian canal of facial nerve. The tympanic segment of the facial nerve canal. Lateral semicircular canal. Processus cochleaiformis. The tendon of tensor tympani takes a turn on this process and then is inserted on neck of the malleus. Processus cochleaiformis is an important surgical landmark for the level of the genu of the facial nerve. Question number 15. Pronator quadratus has same innervation as the following muscle: flexor pollicis longus, flexor digitorum superficialis, palmaris longus, D. flexor digitorum profundus of middle ear, and flexor carpi ulnaris. Answer is A, B, C and D except E. Flexor pollicis longus, flexor digitorum superficialis, palmaris longus, and flexor digitorum profundus of middle finger. All the flexor muscles of the forearm supplied by medial nerve, except the flexor ulnaris and the medial half of the flexor digitorum profundus to the ulnar to third, two fingers, that is fourth and fifth. Medial nerve innervation is like this. Medial nerve innervates the majority of the muscles in the anterior forearm and some intrinsic hand muscles. Anterior forearm innervates muscles in the superficial and intermediate layers. Superficial layer pronator teres, flexor carpi, radialis and palmaris longus. Intermediate layer flexor digitorum superficialis. The medial nerve also gave rise to the anterior interosseous nerve, which supplies the deep flexors. Deep layer flexor pollicis longus, pronator quadratus, and the lateral half of the flexor digitorum profundus. The medial half of the muscle is innervated by ulnar nerve. Hand. The medial nerve innervates some of the muscles of the hand via two branches, recurrent branch and palmar digital branch. Recurrent branch for thenar muscles and palmar digital branch innervates the lateral two lumbricals. Question number 16. Supination and pronation does not take place at superior radioulnar joint, medial radioulnar joint, inferior radioulnar joint, radiocarpal joint, mid-carpal joint. Correct answer is D and E. Radiocarpal joint and mid-carpal joint. Forearm rotation, supination, pronation occurs at radioulnar joint complex, that is superior proximal radioulnar joint, inferior distal radioulnar joint, and mid radioulnar joint. Movement of muscle responsible for the movement is supination is done by supinator, which elbow is extended when elbow is extended. Biceps brachii when elbow is flexed. Brachioradialis supinates the pronated forearm to mid-prone position. Pronations, pronatus, rapid pronator, pronator quadratus, strong pronator. Brachioradialis pronates the superficial forearm to mid-prone position. Question number 17. Occlusion occurs at the second part of maxillary artery. Blood flow is maintained by which of the following anastomosis? Suprascapular artery and post circumflex humeral artery, anterior and posterior circumflex humeral artery, circumflex scapular and posterior circumflex humeral artery, deep branch of transverse cervical artery and subscapular artery, anterior circumflex artery and subscapular artery. Correct answer is A and D. A and D. That is suprascapular artery and post circumflex humeral artery. Deep branches of transverse cervical artery and subscapular artery. Anastomosis around the scapula provide blood supply to distal part if first and second part of axillary artery is blocked. Anastomosis around scapula connects the first part of subclavian artery with the third part of the axillary artery. Anastomosis around scapula connects first part of subclavian and third part of axillary. Around body of scapula, suprascapular branch first from subclavian, deep branch of transverse cervical, branch of thoracic trunk for first part of subclavian, circumflex scapular branch of subscapular branch of third part of the axillary. On the acromion process, acromial branch of the thoracoacromial, that is branch of second part of the axillary, ascending branch of the posterior circumflex humeral, branch of third part of the axillary, acromial branch of suprascapular, branch of first part of the subclavian. While reading explanation, please keep diagram in front of you for the clearance of concept. Question number 18. True regarding red pulp of spleen is periarteriolar lymphoid sheath, B cell containing lymphoid follicle, perisinusoidal macrophages, D composed of sinusoids and splenic cord, E removal of old RBCs and modification of new cells. Correct answer is C, D, E. That is perisinusoidal macrophages composed of sinusoids and splenic cords, removal of old RBC and modification of new cells. Structure of splenic parenchyma. The spleen comprises many units of the red pulp, white pulp, which are centered around central arterioles, smaller branches of splenic artery. Red pulp. Red pulp contains large number of venous sinusoids draining into tributaries of splenic vein. Venous sinusoids are lined by endothelial stave cells which form incomplete layer and present intracellular slits between them though which blood can percolate. Surrounding sinuses is parenchyma which contains lymphocytes, macrophages, plasma cells, etc. It metabolizes senescent red blood cells, erythrocytes. Adjacent blood space contain blood cells and arranged in cord called splenic cord of Billroth, splenic cord of reticulin fibers. Question number 19. Posterior intraosseous nerve supplies all except external carpi radialis longus, external carpi ulnaris, extensor digitorum, extensor indicis, flexor carpi ulnaris. Answer is A and E. Extensor carpi radialis longus and flexor carpi ulnaris. The posterior intraosseous nerve is a pure motor nerve and innervates supinator and extensor carpi radialis. It supplies extensor carpi ulnaris, digitorum and digitimum, abductor pollicis longus, extensor pollicis longus brevis and extensor indicis. Always keep diagram in front of you while reading these MCQs. Question number 20. Muscles of anterior compartment of leg is peroneus tertius, peroneus brevis, peroneus longus, flexor digitorum longus, flexor hallucis longus. Correct answer is A. Peroneus tertius. The fourth muscle of anterior compartment of leg are four muscle of the anterior compartment leg are tibialis anterior, extensor digitorum longus, extensor hallucis longus and fibularis, that is peroneus tertius. We'll stop here. Each day we will do 10 MCQs of the subject. This was the second part of anatomy MCQ series for FMG, Neet PG and next in PG pattern anatomy. Guys, like, सब्सक्राइब एंड कमेंट करना ना भूलिए. धन्यवाद.